Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we'll be hearing from Kathleen, an outreach specialist from the Protea Group at UW-Madison. Hey Kathleen, how are you today?
Good, how are you?
Good, I'm good. So tell me, how does stigma harm people seeking or in recovery?
Stigma can be really harmful for people seeking treatment and recovery for use disorders. What I see as an outreach specialist, outreach worker in the Protea group is really when people or individuals feel stigmatized by healthcare professionals, doctors, nurses, maybe people in an emergency room setting, they're less likely to want to go to the doctor or nurse and an trusted healthcare professional and really get the care that they need and might be ready for. I think it's really important that we all kind of take a look at the stigma that surrounds use disorders and how we can each lessen that stigma for people so that they feel comfortable in seeking treatment when they're ready.
Absolutely. And how does stigma against people perpetuate substance use disorder?
Yeah, I think it can really be a vicious cycle for folks that want to seek treatment and are ready to get care, but have maybe had a very stigmatizing experience in the past. Um, in a healthcare setting, I think that makes them really hesitant and think twice before going back and seeking care in the future. And so, the more that we can work on stigma and reduce our own stigmas and our own biases against, um, our communities and partners that may be struggling with use disorder, I think that can really cut back on the cycle of abuse and stop that from happening to people and really make sure that they are um, met where they're at and to get care.
Yeah, absolutely. It is a barrier. Stigma in healthcare, that's the place where people go for help. And when stigma exists in those settings, it sends a message that, in addition to stigma being out there in the community, it's like, well, I'm going to people for help and it's there too. And so now what? Now who can I even go to for help? And it kind of can take away hope.
Exactly. And, you know, I work a lot with nurses, doctors, behavioral health folks in trainings. And what we've really seen from people with lived experience who we get to come in and speak to these groups is that that connection with their healthcare provider is so important and such a huge step for folks to take that it could be very scary to ask for help. And so if you've had a really poor experience in the past, even if it doesn't relate to your substance use disorder and that's kind of been thrown in the mix that really harms people from seeking care in the future. But on the flip side, when we've seen that people um, visit their doctor or their emergency department and are met with compassion and knowledge and care, that's really made all the difference for them in their recovery and in their journey.
Yeah, absolutely. Is there anything else you'd like to add?
I think just that stigma, you know, we all have stigma, we all have our own biases, and I think just taking a look um, at the language that we use and the way our beliefs influence our interactions with folks in recovery or seeking recovery is super important. And um, I'm looking forward to hearing what other people are doing to reduce stigma across different sectors in Wisconsin.
Thank you so much, Kathleen, for sharing your views on stigma. And thank you to our viewers for watching. Speak on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a great day.